I created courses that would address things in a very clinically relevant fashion, similar to the way I recently developed a CME curriculum for LearnSkin, where we're going to review some of the best lectures that I've had over the course of the past 15 years.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how's it going? Are you feeling kind of that extra feminine energy today?
Oh, my friend, we need to talk about this because, as it turns out, and shocking statistics, most of my patients are women. And another shocking statistic, I'm a guy. And so a lot of us need to learn.
Shocking,
I know. A lot of us need to learn about women's health and how it works in dermatology, because we can always get better. I mean, I think even if you're a veteran dermatologist, physician, whatever practice you're practicing, you always want to get better at what you do. And this is certainly an area that keeps on growing, and we learn new things. So as always, we need an expert to guide us. You got someone?
We definitely have an expert today. We have Dr. Jenny Murase, who's an associate clinical professor at the University of California, San Francisco. She's also the director of medical consultative dermatology and patch testing at the Palo Alto Foundation Medical Group. And of course, the women's dermatology connection is that she gives these amazing lectures on pregnancy and women's health dermatoses. And she's the co-editor-in-chief of the International Journal of Women's Dermatology and has authored 135 peer-reviewed publications and 12 book chapters. So Jenny, I guess you've done a little bit in this area, haven't you? Welcome to the podcast.
Yeah, just a tad. When I was speaking a few days ago at the International Congress of Dermatology, I calculated that I've been working on psoriasis and pregnancy for 20 years, and that made me feel so old.
Oh my gosh, where does the time go?
I know.
Well, thank you for saying this, because I wanted to tell you, I'm so excited to have you here. I mean, I remember as a resident, and I didn't want to date things, but since you put perspective on it, I'll go ahead and say it. But when I was a resident, one of your amazing publications on medications safe or not safe to use during pregnancy and dermatology was in my pocket always. As a resident and as a practicing physician, I have a table. It's right there from the JAD publication. Things have changed a little bit now, but definitely very excited to have you here. And thank you for all the work you've done on behalf of everybody, not just women. I think we all are very appreciative of your work.
That's really sweet of you to say. I know when I go to residency programs and they have the table up, it really makes me feel good to see that it's being used to help care for patients.
Yes, it's the simple things, right? Just put all the stuff in a table that's useful and boom, it's a hit. So let's dive into this, Jenny, because I think one of the things that we're always curious about are the people behind what are the stories. And maybe you can tell us what got you started on this. How did you start thinking about women's health, and what motivated you to make it a thing, make it a choice in your career?
Well, when I was at Stanford in my undergraduate, I worked with Carl Murase, who's known as father of the birth control pill. And I did some research with him. And so when I entered medical school, I actually thought that I wanted to go into OBGYN. And one of the first lectures that we had for our microbiology class was a clinical correlate. And the chair of the dermatology department brought a woman in who had psoriasis from head to toe. And she said that the only 3 times in her life that she completely cleared was during her 3 pregnancies. And so I really wanted to know what it was about the pregnancy that caused the psoriasis to improve. And so I created a clinical trial that lasted the full 4 years of medical school, and I had about 65 patients that were involved with it, and we examined how psoriasis changed in pregnancy and postpartum and correlated with hormone levels. So that was when I first became interested in the overlap between dermatology and women's health. And then when I finished residency, I decided that the academy could benefit from some revision of the curriculum related to women's health. And so I thought long and hard about what dermatologists needed to know, and I created courses that would address things in a very clinically relevant fashion, similar to the way I recently developed a CME curriculum for LearnSkin, where we're going to review some of the best lectures and the best lecturers that I've had over the course of the past 15 years running that curriculum.
What an awesome segue, Jenny, because we did want to talk about this curriculum. I guess before you jump into that, though, can you talk a little bit about what is women's health? How is that defined? And how do you differentiate that from, say, men's health? And then can you also weave in what you're trying to do with the LearnSkin CME series on women's health?
Sure, certainly. And to be clear, some of the lectures that I have directly addressed men's health as well. So I kind of see it as a gender, in general, things that are specific to, for example, a male patient who is trying to make sure that he can conceive with his wife. How medications affect his fertility, for example. We've covered that in the curriculum. But in general, I would say women's health is defined in issues that affect women specifically. So we've had the safety of medicines in pregnancy, it was alluded to earlier, as well as lactation. We've had mastitis and breastfeeding issues in women, safety of the medicines in a breastfeeding patient for both the newborn as well as the mother, of course. Also, hormonal changes, so polycystic ovarian syndrome and different kinds of acne and hormonal testing that can be done, hirsutism, of course, things that affect the vulva. So that would include forms of pruritus or different scarring conditions that can occur. Also, we've had talks on vaginal rejuvenation, and the CME series that we'll be doing for LearnSkin has Neil Sadek commenting on that, which is something that's sort of new and upcoming in the field. We talk about alopecia management in women, and I think that there are many dermatologic conditions that affect both men and women, but some can affect women more, whether it's psychosocial impact. For example, psoriasis has a higher impact on women in terms of, depression or anxiety, for example. So just highlighting things that are sort of specific to the female gender.
I think it's so important for doctors to kind of understand the differences. And it's sometimes just a subtlety and approach, right? I mean, as doctors, we graduate medical school in our, let's say, late 20s, early 30s, and we're expected not just to know and think and kind of understand what the other gender thinks, but also to understand different age, right? So how do you at your early 30s understand what's going on in the mind of an 80-year-old? And so I really view that as very important to develop your toolkit as a dermatologist by understanding how you're going to approach these issues. And to that end, I wanted to ask you, in your experience teaching globally, what have you noticed to be the most common error that young dermatologists or any practicing dermatologists usually make when they come to approach these issues of women's health and dermatology?
Well, I think that one of the biggest oversights that I see in our field is that I think that physicians don't appreciate how often a patient can become pregnant on the medicine that a physician is prescribing for a chronic condition. And, really any chronic condition applies in the situation, but there are many conditions in dermatology that we treat that are chronic. So atopic dermatitis, for example, psoriasis, acne. And if you look at the data in the United States, 50% of pregnancies occur without any conversation with any medical provider. And if you look at specialists specifically, 80% of the time, the physician is not involved. So there's no conversation prior to conception. And women often find out they're pregnant at about 6 to 10 weeks gestation, which is when the major organs have already been formed, in the first trimester. And so really the onus is on us as dermatologists to make sure that we're having that conversation for our female patients of childbearing age when we're placing them on chronic medication for a chronic condition. And I think oftentimes that is not done as much as it should be, because, the focus on the visit is just making sure that let's say the doxycycline was prescribed for the acne. And since the patient's not bringing it up on their own, that there's a chance that they could get pregnant, the conversation doesn't occur when it should.
Yes, no, absolutely. I think that's a very valid point. And I got to say, I sometimes, when I prescribe medications, I fail to think about that. And I wonder if you have a strategy, because the time is limited, right? In the visit, we have a lot to cover. How do you do that? From a strategy standpoint, is that something you do right away up front? There's some topics in there that you leave for, let's say, the follow-up visit. What kind of strategy do you use to make sure that you cover these topics appropriately within the time limits, right, of managed care practice?
Yeah, and I think that's what we all struggle with. And I personally use my staff very heavily in order to be able to see the volume of patients that I do, because I direct a medical consultative practice, and the vast majority of my patients that come in are on high-risk medications for chronic conditions, usually recalcitrant dermatitis and recalcitrant pruritus or psoriasis. And so I'm very, very reliant to make sure that my staff take a really good intake. So before I get in the room, I have everything at my fingertips, because I don't have the time to ask these questions during the course of the visit. I need to have the information right there for me. So I'll ask for every patient, they're asked if they're pregnant or planning pregnancy or breastfeeding, and that's part of the intake, so that when I'm in the room, I could already see that information. I don't have to take the time to ask. And that would apply to the medications. So I'll have already prepared for me how long they've been on the medicines. Have they had any side effects from them? Are they taking them at the appropriate dosage? All of that background information is obtained by the staff. And I think so it ultimately comes down to creating smart phrases in the electronic medical record, or making sure the staff are well trained to gather the information for you so it doesn't take you more time.
Yeah, that's an excellent tip and definitely very useful. Thank you for that. I wanted to ask you, at the risk of kind of putting all women on this planet in one bucket and making you the representative of that population, but this is for the guys, right? There was a famous movie when I was, I don't know, a teenager, called What Women Want. But when a male physician approaches a female patient for whatever reason, in your kind of experience, and again, I know there's a caveat that you're not going to represent the entire female sex, but what kind of mistakes or oversights are commonly done that you see in your trainees, residents around you, other doctors, and you're like, oh, what a missed opportunity, or what an unfortunate error that you see commonly that especially male doctors can improve on?
I think that a lot of times patients with chronic conditions that can affect the genital area, it's hard because asking to see that area, if the patient hasn't brought it up themselves, can feel a little bit intrusive.
Yes, absolutely. Yes.
Yeah, if it's a female patient and a male doctor, I would imagine it would be much more so. And I even feel that as a female doctor asking a female patient or a male patient. So I can imagine it would be compounded many times if it were, the opposite. So, I think it's important to be aware of the dermatologic conditions that are more likely to affect that area. And if you're not comfortable asking yourself, you can have your nursing staff ask the patients in advance, including the intake. So, for a chronic plaque psoriasis patient, psoriasis of the genital area is way underreported, and oftentimes patients are embarrassed to mention it. That's true for atopic dermatitis as well, but has been demonstrated to be true much more for psoriasis in the genital area. So having that as part of the intake, just like we would ask about the joints or the eyes as part of the intake as well, for uveitis and, trying to catch psoriatic arthritis, which can often be 5 to 10 years delayed onset from the psoriasis diagnosis. That's a way you can use your staff and make sure that that's captured, because I think that we tend to feel embarrassed about asking more than the patient does, because the patient sees us as a medical provider who is in charge of asking those questions.
Yeah,
So,
that's very true.
yeah. And, when you actually ask, it allows them to feel also more comfortable themselves bringing it up. I mean, you can imagine if you had chronic itching in your anal area or your genital area, that's when you're sitting, you'll feel it. It affects you all throughout the day, and certainly with sexual intercourse, but it can also make it very difficult to sleep at night. And, when the distractions of the day are no longer there, the chronic itching. And so it really is important for us to ask. So I would say either incorporating it into the intake or just really trying to ask the right questions.
Yeah, and I think you hit it right on the point, at least in my experience. The point is really to ask. You sometimes don't even have to look. If the patient is not ready for that or not interested at that time, I think it's super, super important to ask. I've try to become more cognizant of that and really try to make a point. I usually leave it towards the end of the visit when, especially in the first visit, when that trust is there and the patient feels like, okay, we're really addressing the issues that are important. Then I try to ask and bring it up, of course, for the diseases that are relevant. Another thing I try to do, especially, I see a lot of patients with hidradenitis suppurativa, a disease that definitely affects those areas. I mean, pretty much 90% of what I do is look at the breasts and growings and buttocks, and it's very, very uncomfortable for everybody involved, not to mention that it's painful in HS. And one of the things that we try to do is using the staff as you suggested, but making sure that they know they're going to get into a gown, and the expectation is that we will do this. And I think it's my medical duty to actually document the baseline when we start. One of the things I notice about people with HS is that they're tough. They'll come in and say, I'll ask them, how are you doing today? And there's like, the armpit is really bad. And then I say, what about your buttocks? And they say, it's fine. And then when I look, the disease is really flaring there. They're just so tough. They learn to live with that. And so they don't even count it. And we can help, right? And so I think it's an opportunity to make a difference, to make a real difference where it matters, like you so beautifully explained about the quality of life, the effect of these diseases in this area. So yeah, it's sometimes just asking or sending like almost like a visual cue. You're going to be in a gown. That means that, things are going to be looked at. And then with using the staff to kind of help getting that going, I think it's very important. Thank you for saying that.
Yeah, I think hidradenitis is a great example of a condition where female patients, of course, both genders are affected, but female patients in particular are really affected by that condition. And we have a set of 30 articles within the International Journal of Women's Dermatology. They're online open access, so you don't have to have any special Medline account to see them. If you go to the wdsijwd.org website and you go under the special issues tab, you can see the special collection of hidradenitis articles. And there's a lot of very practical articles to refer even patients to that are female patients suffering with that condition. So I use those regularly in my practice, caring for women specifically with hidradenitis.
So now, Jenny, I'd like, if you don't mind, to dive into the series, because the series that you're sharing on the LearnSkin platform, I looked at that lineup. It looks really exciting.
It's pretty varied. It's very varied.
It seems like, and I think you kind of mentioned that these are some of the best topics or best lectures that you collected over the years. Is that how you came around to that lineup?
Yeah, so for the past 15 years, I have been running the American Academy of Dermatology Women's Health Therapeutic Symposium, and I've also done the summer AAD as well, and so both the AAD and the summer AAD, and so I've also chaired the European Academy of Dermatology and Venerology pregnancy session, as well as the World Congress a few times. So I basically have had to have people lecture on women's health related issues many, many times. And I basically picked some of my favorite topics and lectures that I've seen do a great job and collected them to create this series.
What a brilliant idea. So can you tell us some of the highlights? What can we expect when this series launches?
Certainly. So I will be talking about managing skin disease, psoriasis, and atopic dermatitis, acne, etc. during pregnancy. And Dr. Honor Fullerton-Stone will be addressing safety in lactation, as well as how to treat mastitis in the breastfeeding female patient.
And then, yes, very important. Yes.
Yeah. So those are very practical lectures. Pretty much within a week, you can use the information in your practice and caring for patients. Dr. Brian Ginsberg from NYU will be talking about transgender dermatology. We're also going to have talks related to acne in transgender patients as well as female patients, sort of hormonal-based acne and how the hormonal treatments can vary in women specifically. I mean, they have more options, honestly, for acne than men do. And so we'll go into details in that regard. And then Dr. Rachel Cornick will discuss the management of genital pruritus in women, which can be very tricky and challenging to address. Neil Sadik will talk about the vaginal rejuvenation procedure that I alluded to earlier. And then I decided to have the alopecia given by two different lectures. So Parati Mirmarani will talk about hair curl types 1 and 2. So kind of a less of a curl and kind of a softer hair curl type. And then we're going to compare and contrast that with alopecia management in patients with hair curl types 3 and 4, so a denser, sort of more kinkier hair that would be common in our skin of color patients. And Valerie Callender will comment on the management of alopecia in that group.
What a lineup.
Yeah, right. Roger, I want to listen to it now. Is it
Oh
available?
my
When
gosh,
is it
no,
available?
what a lineup. And Jenny, I have a question for you, just kind of as we wrap things up with the podcast, because this has been awesome just talking to you about all these different things that you're doing. One thing that stands out to me is I feel like you have probably like an overall goal of what you want to achieve in this space. And you're also the editor-in-chief of the International Journal of Women's Health. Can you speak a little bit about what are your future goals? I guess my mentor, Howard Maybach, who is definitely, is always asking me what I'm going to do when I grow up. What are you going to do when you grow up? And what are you doing with the International Journal of Women's Health?
Yeah. Thank you for asking. So I founded and then I currently chair the expert health resource group in women's health for the Academy. And so we've been trying to develop that group so that we have basically, when I've had different people speak and identify key opinion leaders in women's health, we've been trying to develop that community so that it's more cohesive and that we can work on projects. I just did a project with the Mayo Clinic regarding more effective way to diagnose different dermatoses of pregnancy without performing biopsies and just based on different clinical questions, for example. So there really hasn't been a cohesive research community, and we're trying to create one. Also, recently, Dr. Shadi Kourosh from Harvard asked me to be involved with a women's health task force that's being developed under President-elect Terry Cronin for the Academy. So I will likely be involved with that as well. I sort of wear two hats. And so what I focused on developing and becoming very involved with this year is actually more related to all of the work and research that I've done on atopic dermatitis and allergic contact dermatitis. Just because I'm kind of known as the rash whisperer, I'm able to get any rash under control. So I'm going to actually be a little bit more focused on that than women's health, but those are the things that I'll be doing regarding women's health specifically.
The rash whisperer. I love that.
Yes.
Well, we will end this on a loud note by saying thank you very much for joining us. Not a whisper, not at all. And you've always been such a clear voice in our community. And again, I'll end where we started by thanking you for your time, expertise, for sharing this with everyone. I think any trainee and all the way to experienced dermatologists are better clinicians thanks to your contributions. So thank you for your time.
Oh, my pleasure. It was a pleasure talking to you both.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf, or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. You know, use our discount code POD25 at checkout for 25% off.